All right, let's get started. Next slide, please, Winston. Hello again, this is Adam Romero with the Williams Institute, and welcome to our webinar on gun violence impacting the LGBT population. Thank you for joining us to learn about this profoundly important topic. First, some logistical instructions. If you're using Internet Explorer or Safari as your internet browser, we recommend signing out and logging back in through Chrome or Firefox to avoid any compatibility issues. Everyone should be muted right now except for the speakers, and we're muting everyone just in case anyone out there is not in a quiet place. We don't want any background noise interrupting the webinar. However, we encourage you to ask questions as the webinar goes on or during the question and answer portion. To ask a question, simply type your question in the chat box, and to access the chat box, there's an icon in the bottom left corner. Rachel, the Williams Institute's Communications Director, will gather the questions and then we will address them during the Q&A part of the webinar. If you have any technical difficulties, you can type those into the chat box too, and Winston, our brilliant administrator, will help you. Next slide. For those of you who don't know about the Williams Institute, we are a research center at UCLA School of Law focused on lesbian, gay, bisexual, and transgender populations. Though we are housed at a law school and do legal scholarship, we have scholars from a variety of disciplines such as public health, demography, economics, community psychology, and social epidemiology. Our mission is to produce rigorous, independent research that impacts and improves law and policy. Our research topics cover everything from discrimination against LGBT people in employment, housing, and education, to relationships and families, to poverty and food insecurity, to experiences in the criminal justice system, to variability in all of these topics by race, ethnicity, geography, and other characteristics. Basically, anything that you might think of, there's a good chance that our scholars have investigated it, so we encourage you to check out all of our studies and data interactives and other resources on our website. Next page. I'm pleased to introduce our speakers today, and in the interest of time, I'm only going to say a brief word about each. Again, I am Adam Romero, and I was the principal investigator of the Williams Institute's recent string of projects on gun violence. Our first speaker after me will be Brian Malte, who is the executive director of the Hope and Heal Fund, which has had the vision and foresight to fund research on gun violence, including but not only against LGBT people. Oftentimes, I think people want to get right to the solution, and of course I get that urge, but rigorous research is a necessary foundation for designing and evaluating violence prevention strategies in our very diverse population. Before becoming the executive director of the Hope and Heal Fund, Brian served as the national field director, the political director, and then most recently as the national policy director for the Brady Center to Prevent Gun Violence. Brian has worked with dozens of state legislatures in the halls of Congress and with the White House to advocate for sensible gun reforms. Next, Ari Shah and I will be detailing some of the findings from the Williams Institute's most recent report that tracks everything we know and don't know from a research perspective about gun violence impacting sexual and gender minorities in the United States. Ari, who has a PhD in political science, is a co-author of our report and a frequent collaborator of the Williams Institute on a range of civil and human rights issues. Then, Shoshana Goldberg will be presenting findings from another study that the Williams Institute recently published on gun ownership and attitudes towards gun reform laws among LGBT people compared to non-LGBT people. Shoshana is also an affiliate of the Williams Institute and is also a professor at UNC Chapel Hill. I'll then discuss recommendations from the Williams Institute about research needs and data gaps, which are vast in this area, as you will hear. And finally, Saya Magsulu will be discussing important research that she is doing at Everytown for gun safety, tracking homicides of transgender people and helping fill a critical data gap. Salia has an MPA from NYU and previously worked at the Human Rights Campaign. And then finally, we should have about 10 minutes for questions and answers. Next slide. Brian.
Thanks, Adam. Can you hear me?
Yep.
Great. Good morning, everybody. Again, my name is Brian Malty, Executive Director of the Hope and Heal Fund. And we are incredibly thrilled and pleased to be funding the Williams Institute on this incredibly important report. For those of you first who aren't familiar with the Hope and Heal Fund, Hope and Heal Fund was created in 2016 by philanthropic leaders, and we're the only state-based collaborative fund solely dedicated to preventing gun violence. We know that those closest to the problem are closest to the solution, and therefore we take a real public health, community-based approach to gun violence in California and harness the power of individuals, communities, government, and philanthropy to make homes and communities in California safe and free from gun death, injury, and trauma. And, for me, this report is more than just a report. I think it's part also of a personal journey I've had on this issue. And I think this all started, as folks may recall, the terrible tragedy of the Pulse nightclub shooting on June 12, 2016. And at the time, it was the worst mass murder in U.S. history, with 49 innocent people murdered and 53 others injured. And many of those victims were from the LGBTQ community. After the shooting, as Adam said, as National Policy Director at Brady, I had the privilege to escort survivor Angel Colon, who was shot multiple times at the Pulse shooting, and take him around Capitol Hill to meet with members of Congress and other elected officials. And, while he's doing very well recovering from his injuries from this horrible shooting, he was and still remains a real inspiration to me that just weeks after the shooting, he made his voice heard on Capitol Hill. Now, this tragedy also led me on a journey to start asking more questions. What do we know about the intersection of LGBTQ and gun violence? Is it suicide? Is it hate crimes? Where's the gun violence taking place? Right? We need to know more. And the more questions I asked of different groups and different folks involved in the LGBTQ community, it was clear that we didn't know a lot, but it was clear that we needed to know more. And so when I came to Hope and Heal, we set out on a journey to say, how can we start this process? And quickly was led to the Williams Institute. And obviously, the great work that they've done and they did on this report is an incredible roadmap to what we need to do next. We have found out some interesting things to this report, but it's clear there's a lot that we don't know, but we need to know. For us at Hope and Heal, if we're taking a true public health approach to this, we need to know the data, and we need to know what the actionable data is so that we can best help as a funder formulate solutions. So I've gotten to know the folks at the Williams Institute over the last few years. They're wonderful folks. You all know the great work that they do. And again, I just say from the Hope and Heal team, we are incredibly proud to have funded this work, and we're incredibly invested to make sure that together, collaboratively, we get to the next steps so we get the actionable data we need to save lives. Thanks, Adam.
Thanks, Brian. Next slide, please. So at the Williams Institute, we have done a lot of research on different forms of violence against LGBT people, but we had never actually looked specifically at the role of firearms in that violence. So we very much appreciated support from Brian and the Hope and Heal Fund, really to take a pioneering look at gun violence impacting LGBT people. And specifically, we worked on 3 interrelated projects. First, to host a convening of experts to do a quantitative study and to publish a report reviewing everything we know and don't know from a research perspective about self-harm, intimate partner violence, and community violence involving LGBT people and guns. I'd say, to sum up the goal of our projects, it was to establish a baseline understanding about gun violence impacting LGBT people, to identify data gaps, and to establish a research agenda, none of which had ever been done before, and which is, as Brian was saying, critical to the work of policymakers, public health departments, nonprofits, advocates, and others who want to design effective interventions to prevent gun violence. Next slide. So on April 30th of this year, we published a pretty massive report reviewing hundreds of different studies, and we sought to find everything we could out there that discussed guns in relation to LGBT people, but there were really only a handful of such studies. So what we did in this report was discuss that very small amount of research with information specific to LGBT people and guns in the broader context of research on gun violence in the general U.S. population, as well as research on violence against LGBT people, but that didn't address guns in particular. And we looked not only at research on violence itself, but also research on violence prevention. Given the severe dearth of studies out there specific to LGBT people and guns, a significant portion of our report is dedicated to documenting particular gaps in knowledge and data in order to establish a blueprint for the future. Before Ari details for us some of the findings from the report, let me just quickly give a few statistics on firearm violence in the general U.S. population to help set the stage. From 2001 to 2017, more than 550,000 people in the United States died by firearm, according to the Centers for Disease Control and Prevention. And the annual number of firearm deaths has climbed almost every year since 2001. The largest categories of firearm deaths between 2001 and 2017 are suicide at nearly 60% of firearm deaths, followed by homicide at about 37%, making suicide and homicide the leading causes of violent death in the United States. Firearm violence not only impacts, of course, those physically involved, but also reverberates through and can shatter the lives of family members and communities. The economic burden of gun violence in the United States is enormous. Just hospital emergency room and inpatient charges alone related to shootings are estimated to be $2.8 billion annually. Globally, the United States was second only to Brazil in the total number of firearm deaths in 2016. And although the United States had only 4.3% of the global population that year, it had 35% of the global firearm suicides. Firearm violence, of course, is not evenly distributed in the U.S. population. According to CDC data, for example, the vast majority of firearm deaths between 2001 and 2017, firearm suicides between 2001 and 2017 were white non-Hispanic males. By contrast, in this time period, black non-Hispanic males represented the majority of firearm homicide deaths. And now let's turn to Ari to look at the findings from our report. Next slide.
Thanks, Adam. Well, I encourage everyone to review the full report to get really the broadest sense of available research. I'd like to present a brief overview of some of the key takeaways as a starting point. I think that when we think of gun violence, and especially gun violence impacting the LGBT community, many of us think of mass shootings, as Brian mentioned, like the one at the Orlando Gay Club Pulse in 2016. Mass shootings, of course, are especially horrific, and when they target minority groups such as LGBT people, the threat feels even more potent. But as we discuss in our report, mass shootings really are an uncommon form of firearm violence relative to suicides and individual homicides, many of which happen between intimate partners. And so when we think about gun violence and how to prevent it, we really have to take a view that is broad and multifaceted. For this report, we broke down the research into 3 broad categories. The first is suicide deaths, attempts, and ideation. The second is interpersonal violence, or IPV. And the third is community violence, such as hate crimes, school violence, and mass shootings. Overall, we found that gun violence is a significant concern for LGBT people in the United States. For example, guns were used in nearly 60% of bias-motivated homicides of LGBT people. This was as tracked by the National Coalition of Anti-Violence Projects in 2017. In addition to their role in intentional killings by others, firearms are widely used in suicides in the United States. They're also used to intimidate and threaten, and firearms can cause unintentional deaths and injuries as well. Gun violence in the LGBT population is of significant concern given the substantial research finding that LGBT people have a higher prevalence of suicide ideation and attempts. They have comparable or higher prevalence of intimate partner violence and a higher lifetime prevalence of victimization from hate crimes, school-based violence, and discrimination. This all compared to non-LGBT people. The scarcity of research specifically addressing gun violence against LGBT people in part reflects the fact that gun violence across the US population is generally understudied, but studying gun violence against LGBT people is particularly challenging because of a lack of data. Researchers have developed best practices for measuring sexual orientation and gender identity in population-based surveys and other data systems, but our death and injury surveillance systems typically don't measure victims or perpetrators' sexual orientations, gender identities, or gender expressions. For instance, no US jurisdiction or agency routinely or systematically collects the sexual orientations or gender identities of decedents. And although the CDC's National Violent Death Reporting System, or NVDRS, has included codes for sexual orientation and gender identity since 2013, there are substantial challenges to accurately and fully collecting this information for decedents, and I'll touch on that a bit more later. Next slide, please. LGBT people have a higher prevalence of suicide attempts and ideation as compared to non-LGBT peers. And this is connected to stigma and prejudice against minority sexual orientations and gender identities. For example, according to the CDC, in 2017, 47.7% of gay, lesbian, or bisexual students, as compared to 13.3% of heterosexual students, had seriously considered suicide in the 12 months before the survey. The chart displayed on this slide shows how these rates are slightly less for students who actually attempted suicide, although LGBT students are still disproportionately represented among this population. Suicide attempts are especially prevalent among transgender youth, with one recent study finding 34.6% of transgender youth had attempted suicide in the past year, compared to 9.1% of cisgender girls and 5.5% of cisgender boys. Next slide, please. We also know from the research that in the general population, suicides comprise 3/5 of firearm deaths each year, that firearms are lethal in 85% of suicide attempts, and that access to guns raises the overall risk of suicide deaths. However, very little research and data rather exists on suicide deaths among LGBT adults and youth. Likewise, research has not systematically investigated methods of suicide among LGBT people or the role of guns in suicide attempts and ideation among LGBT people. Again, a lack of data is really the problem here. As I mentioned, because the NVDRS does not systematically collect information about decedents' sexual orientation or gender identity, researchers are forced to essentially conduct social autopsies, which are informative but are severely limited. And suicide prevention services for LGBT people, such as the Trevor Project, don't collect information about methods. So there's so much more to say, but let me turn now to IPV, or interpersonal violence. Next slide, please. Research on IPV among LGBT people is limited, but finds that they experience IPV at a prevalence equal to or even higher than the general US population. Bisexual women in particular report high levels of IPV at the hands of male partners, as you can see in Figure 5. Data on transgender IPV survivors and perpetrators are limited to non-representative samples, but these indicate levels of IPV that are similar to, or again, even higher than the general population. Research on intimate partner homicides among LGBT people is challenging given the dearth of sexual orientation and gender identity data on death records. Nevertheless, studies of IPH, interpersonal homicide, among same-sex partners find that men are more likely to be victims of IPH than women. Generally, when perpetrators of IPV have access to firearms, the risk of homicide increases. While firearm IPH in the general population was long on the decline, since 2010 there's actually been a 26% increase. Limited research on this indicates that the prevalence of gun use against gay and lesbian victims of IPH may not be as high as with heterosexual victims, and little information exists about when and how firearms are used in non-fatal IPV against LGBT victims. Bisexual women, though, may be particularly at risk for firearm IPV and IPH given the high prevalence of IPV by male partners. According to a recent CDC survey, 15% of bisexual women compared to 4.4% of heterosexual women reported that their partner used a knife or a gun. Next slide. On average, over 10,300 hate crimes involve a firearm each year. Nearly a fifth of hate crimes are based on sexual orientation or gender identity bias, and LGBT people per capita are most likely to be targeted for a hate crime than any other group. And researchers have found that victims of sexual orientation bias crimes are subject to person-based rather than property-based violence at higher rates than victims of religiously or racially motivated crimes. Furthermore, research indicates that gay men are the most frequent victims of anti-LGBT hate crimes. Transgender people, especially transgender women of color, may be especially vulnerable to biased homicide. Additionally, studies show that LGBT youth are subjected to a higher prevalence of school-based violence than non-LGBT youth. Some data indicate that hate crimes and school violence against LGBT people may be more likely to involve weapons and physical injury as compared to such violence against non-LGBT people. However, existing research provides, again, limited information on the prevalence of firearms in these and other forms of community violence involving LGBT people. For instance, according to FBI data, a higher percentage of anti-LGBT hate crimes are reported as aggravated assaults than are other bias crimes. However, the FBI's Uniform Crime Reporting Program does not disaggregate the type of weapon used, if any, in these aggravated assaults. Similarly, data on school violence indicates that sexual and gender minority students are more likely to be threatened with a weapon without disaggregating weapon type. Some research also finds that lesbian, gay, bisexual, and queer students are more likely to bring weapons with them to school, and this may possibly be to protect themselves from violence from other students. Next slide, please. As I noted, a lack of data is a huge obstacle. So our report spends quite a bit of time documenting data needs from U.S. death and injury surveillance systems. Death records in particular rarely include accurate information on sexual orientation or gender identity. And this is due to the difficulty of identifying these characteristics post-mortem. Oftentimes, officials have to rely on the testimony of third parties to gather this data. Other surveys, like the National Crime Victimization Survey and the National Intimate Partner and Sexual Violence Survey, only recently began to collect data on sexual orientation and gender identity measures. Next slide. So what can be done to reduce gun violence? Researchers and governmental institutions like the CDC have identified some interventions that reduce gun violence across these three categories of suicide, IPV, and community violence. And while there is little research on LGBT-specific interventions, it's reasonable to conclude that factors reducing or mitigating the effects of gun violence overall will similarly impact the LGBT population. So some of the interventions around suicidal behavior include both mitigating risks and enhancing protective factors. These include strengthening access to and delivery of suicide care, for example, mental health coverage and provider access, creating protective environments through reducing access to lethal means, and teaching coping and problem-solving skills, such as social emotional learning programs. In this category of gun violence in particular, some suggest that healthcare providers and primary care physicians in particular could offer a really effective point of intervention. More broadly, limiting access to guns has been demonstrated to reduce gun violence. Some of the mechanisms of enforcing limited access include comprehensive background checks to prevent people with a history of suicidality from purchasing firearms, permit-to-purchase laws that require gun owners to possess a permit certifying proper training and having undergone a background check, extreme risk protection orders, or ERPO laws. In some states, these are known as gun violence protective orders or gun violence restraining orders, which create a civil court process for temporarily removing firearms from the most clearly dangerous or suicidal people during periods of mental crisis. And also safe storage, where research really suggests an association between safe gun storage practices like trigger locks, storing firearms locked, unloaded, and separately from their locked ammunition, and a lower risk of firearm injury. And in terms of community violence, ecological approaches to reducing risk factors and strengthening protective factors suggest opportunities for intervention at individual, interpersonal, community, and societal levels. And these include teaching nonviolent conflict resolution and problem-solving skills, bolstering family support and connections to school, strengthening connections to community, and more broadly, changing social norms that prescribe the use of violence. Next slide, and Shoshana.
Hi, this is Shoshana. Can everybody hear me okay?
Yep.
Okay. So thank you, Ari, for handing over the microphone. So I am going to report on another report that we put out. This is the one that was published in November that Adam mentioned earlier. So this is actually a quantitative data analysis that we undertook using 2 surveys which collect information on gun ownership and attitudes towards guns, and also include a measure on sexual orientation, which allows us to directly assess differences between LGBT and hetero adults in their gun ownership and attitudes towards guns. As a caveat, you may be wondering what happened to the T, or transgender people. Unfortunately, these surveys only assess sexual orientation and not gender identity. As such, we're not able to examine transgender gun ownership or their attitudes at this time. So right off the bat, that's one big gap that needs to be filled, and goes back to the argument that we're making that more data and more inclusive data is needed on these issues in this population. Really briefly, the data sources that we used are the General Social Survey, or the GSS, and the Cooperative Congressional Election Survey, or the CCES. General Social Survey, conducted by the University of Chicago, is an annual survey which monitors changes in social characteristics among American adults. We use data today from 2008 through 2016 to have sufficient number of LGBT respondents. In total, data is included from about 6,000 people, 240 of whom identified as gay, lesbian, or bisexual, collapsed into a single group. And this survey assesses presence of gun in the home and self-gun ownership, as well as attitudes towards gun permits. The CCES is an online survey.
Next slide, please.
Oh, sorry, yes. Thanks for reminding me, sorry. The CCES, we are using data just from 2016, where we have a total of 55,000 respondents, over 4,000 of whom identified as LGBT. And this survey is used to assess support or opposition to 4 hypothetical measures that were presented to respondents. Next slide. A second caveat is that in the interest of time, I'm only going to walk through a portion of our findings today. For more detailed information about our analyses results, including additional regression analyses and confidence intervals around all the figures I'm going to be presenting today, see the report itself. So the GSS assessed for presence of gun in the home by sexual orientation overall and by biosex and race ethnicity with the question, do you happen to have a gun in your home or garage? And they defined it as guns or revolvers. For anyone who answered yes as opposed to no, a follow-up question probed if the gun specifically belonged to them. An additional attitude question not shown here assessed if respondents would favor or oppose a law which would require a person to obtain a police permit before he or she could buy a gun. Next slide. The CCES was, again, as I mentioned earlier, a study that we used to look at support or opposition to 4 measures listed here, and we'll go into in a little bit more detail in a few seconds. So, as already previously noted, from the limited data we have, LGBT people are at increased risk of experiencing gun violence, either self-inflicted or inflicted by others. So the first thing that we want to know, particularly in light of the idea that having more information is helpful to be able to develop future interventions, is how many people have a gun in their home. Overall, we found that LGBT adults were about half as likely as heterosexual adults to report not having a gun in their home. Over 1/3 of heterosexual adults, or 35%, versus less than 1/5 of LGBT adults reported that, yes, guns or revolvers were in their home or garage. Next slide. From a numeric standpoint, this translates to an estimated 1.9 million LGBT adults with guns in their homes. In addition, we estimate that over 84.8 million heterosexuals have guns in their homes. Though not immediately obvious, the presence of guns in the homes for heterosexuals is relevant to our study here. As we mentioned before, more guns in the community increase the risk that they can be used. For example, many of these heterosexual adults may be raising children who themselves are LGBT. At last estimates from the 2017 YRBS, over 10% of all high school students surveyed identified as LGBT, many of whom are presumably being raised by heterosexual parents. In addition, LGBT youth are at an increased risk of experiencing victimization or bullying with a weapon, and LGBT adults were at increased risk of experiencing a hate crime, which itself is often carried out using a gun. So more guns in the community, regardless of who owns them, further increases risk of these outcomes. Next slide. Among LGBT respondents, there are no gender differences in the presence of gun in the home. Male and female LGBT adults are equally likely to have a gun in the home, with about 20% of LGBT females and 17.3% of LGBT males. In contrast, among straight respondents, males are significantly more likely to have a gun in the home than their females. For both males and females, straight respondents were more likely to have a gun in their home. Next slide. There are much bigger differences emerge when we look by race density. Among LGBT respondents, white adults are significantly and substantively more likely than LGBT adults to have a gun in their home, with over 1/4 of white LGBT adults reporting a gun versus less than 7% of non-Hispanic or of other race LGBT. Similar patterns are seen among straight respondents, with gun ownership far more common among white adults than people of color. Over 44% of straight white adults report a gun in their home versus 16% of straight people of color. As with the previous slide, regardless of race ethnicity, straight respondents were the most likely to have guns in their home than LGBT, with the highest rate of ownership reported among straight white adults. Next slide. As a follow-up, we also looked at whether the gun was owned specifically by the respondent. So among those who reported a gun in their home, we saw no difference in sexual orientation whether the gun was the respondent specifically. So 69% of LGBT respondents who had a gun in their home said it was theirs versus 65% of straight respondents. Though LGBT males and females were approximately equally likely to report a gun in their home, there were some differences in who the gun belonged to. Among males with a gun in their house, straight males are significantly more likely than LGBT males to state the gun is theirs. In contrast, among females with a gun in their home, LGBT females are almost twice as likely as straight women to report that the gun is theirs. No difference, however, was seen in race ethnicity. Among non-Hispanic white respondents, LGBT are only slightly more likely than heteros to report that the gun belongs to them. Among non-white respondents, the reverse is true, though neither difference is statistically significant. Interestingly, however, among all people who have a gun in their home, white LGBT have the highest rate of gun self-ownership compared to other sexual orientation by race groups. Next slide. Within the GSS, we found that despite higher self-ownership of guns among gun owners, LGBT respondents tend to be much more in favor of restrictive gun control laws. For example, in this slide, we see that LGBT respondents were significantly more likely than straight respondents to favor a law that would require somebody to obtain a police permit before they could buy a gun. Next slide. Similar results emerge when we look at the results from the CCES. While equal proportions of LGBT and hetero adults support background checks, that's the columns on the far left, LGBT respondents are significantly less likely to favor policies that would make it easier to obtain a concealed carry permit, and are significantly more likely to favor a ban on assault weapons. Next slide. So a few conclusions from this report. So as Adam noted earlier at the beginning of a webinar, rigorous information and research is needed before interventions and policies can be developed. This report is the one that Ari and Adam briefly discussed before me, offers important information that could be useful for future work. We found that overall, LGBT adults are about half as likely as heterosexuals to have a gun in their home than their heterosexual peers, though some differences emerge by gender and race. For example, though no difference was seen in the presence of gun in a home by gender between LGBT and straight adults, and for both males and females, straight adults are more likely than LGBT to have a gun in their home. Among them, those who do have a gun in their home, LGBT females are more likely to state the gun is theirs. Similarly, among LGBT adults and heterosexuals, gun ownership is highest among non-Hispanic whites. But overall, we're seeing consistently that LGBT adults are slightly more likely to favor gun control measures. So the lower rates of gun ownership that we see are encouraging when we think about reducing risk of gun violence. So the over 1.9 million LGBT households, though, with guns in their home remain at risk of a gun being used against them, either by their own hands or by someone else's. As a result, we don't know why these 11.9 million households have guns, particularly in light of the fact that LGBT adults tend to be more in favor of stricter gun control measures. In addition, the over 84.8 million hetero adults with a gun in their home further increase the risk of interpersonal, family, suicide, and community-level violence being conducted against LGBT adults and children simply by the fact that the gun itself exists. So, like, again, as we said, many of these hetero people may be raising LGBT children, or may themselves be involved in acts of community violence against LGBT folks. So what we really need to know is more about who owns guns, why they own guns, what's being done with these guns, and then from there we can better adjust our interventions to reduce gun violence. Next slide.
Thank you,
Shoshana. Back to Adam.
Thank you, Shoshana. As we've been saying, there's vast data gaps and research gaps, and both of our reports that we published in the last year detail research agendas for each of the different categories that we've looked at: suicide, intimate partner violence, and community violence. I don't have time to go into detail with respect to the research agenda that we've established on each of those different areas, but you'll see here on this slide and the next slide just some top lines, but let me just pull out a few of those. For example, as Ari was saying, we know very little about actual suicide deaths among LGBT people, and we need to expand our knowledge in that area to both understand risk factors for suicide deaths as well as the role of guns in suicides, which in turn would help us better prevent suicides in the LGBT population. And of course, because guns are so lethal, you saw earlier that in the general population, when guns are used in a suicide attempt, they result in death 85% of the time. This is, of course, a very important and consequential area of needed research. Similarly, we need more research on the role of firearms in intimate partner violence and community violence. A big gap in the research and data concerns race and ethnicity, geography, veteran status, socioeconomic status, and other characteristics that have been found to be important dimensions for understanding gun violence in the general population. With respect to LGBT people, however, there is scant research that looks at, say, LGBT veterans or LGBT Latinos or LGBT people living in rural places. Only with better data and more research will we get a fuller picture about how gun violence impacts different subgroups of the LGBT population. For instance, as I said at the beginning, there are different racial and gender patterns for firearm suicide and firearm homicide in the general U.S. population, but we don't know if those patterns hold for LGBT people. We also need to know more about general risk factors for gun violence among LGBT people, such as the role of alcohol abuse, which has been shown to correlate with some forms of gun violence in the general population. Research has long showed that LGBT people have higher rates of alcohol overuse, but we don't know how this research relates to gun violence. We also need to know more about protective factors that reduce risk for gun violence for LGBT people. For example, as Shoshana was detailing with respect to lower rates of gun ownership. Next slide. Here on this slide is some research we recommend specific to interventions against gun violence. We need a lot more information to assess what are the most effective interventions. As but one example relating to what Ari was talking about earlier, research has shown that laws requiring the removal of guns from the homes of perpetrators of intimate partner violence or the homes of people at high risk for suicide is beneficial to preventing intimate partner homicide and suicide death. But such removals are usually done by law enforcement, but law enforcement does not always respond in respectful, useful ways to LGBT people, as we've long seen in the research. So we need to know more about how to effectively enforce these sorts of laws with respect to the LGBT population, and that's just one example. Next slide. Finally, let me note, to inform all of our work that we've done in this area, we hosted an expert convening in November 2018, and our goals for this convening were to gather experts from around, researchers, policy experts, advocates, and others from around the country to discuss and think about gun violence impacting the LGBT population. So we brought together 30 people from around the country, from public health departments, researchers, advocates, and others. And it was a very productive meeting that all of the discussion and proceedings were reflected in our final reports. Next slide, and let me turn it over to Saya now.
Hi, everyone. So as Adam mentioned, one of the few data points we do know about firearms, specifically among LGBTQ populations, is the devastating frequency in which trans people are shot and killed in this country. We haven't known that for long, though. So I'm going to talk a bit today about how we came to know it and what getting data like these actually entails on the day-to-day as a bit of a case study into the work that's being done to fill some of these gaps. Next slide. So my background before working at Everytown is in the LGBTQ movement as well, but having survived a mass shooting at my undergraduate university, UC Santa Barbara, of which today actually marks 5 years since the shooting, I eventually succumbed to the pull I felt to work to curb this nation's gun violence epidemic. But naturally, I couldn't help but research the intersection of these two issues, only to find that we didn't really know much. And when it came to gun violence against the transgender community, we knew nothing. Next slide. This is an actual screenshot I took when I started trying to research the topic to expand Everytown's work on LGBT issues. And so we figured, upon realizing this, that we should just do it ourselves. At the time, there were several back-to-back high-profile murders of trans people, and we kept seeing firearms involved in the incidents, but no one was really talking about the factor of the gun and gun violence as an issue that impacts this community. And so Everytown, next slide, sorry. Everytown became the first gun violence prevention group to track the gun homicides of trans and gender non-conforming people in America. And we do this to highlight this intersection and also to fulfill our overall mission, which is to continue to show an accurate and diverse picture of what gun violence looks like in America. We know that it's not just what you see in the news. It's not just these mass shootings and school shootings. It's happening every day. And so we're continuing to fill these holes where the research and data fail to tell us how much gun violence impacts the LGBT community, and also specifically the Black LGBTQ community, which we'll talk about. Next slide. So let's first just talk about the numbers themselves, and then we'll get into what goes into them. So here's a snapshot of the data. These are screen grabs straight from our tracker to show you all the types of variables that we look at regularly. The most important flag here is that these numbers are likely an undercount. We'll talk about how these are only incidents that are known, meaning they were reported by some sort of media, local news, queer news outlets, social media, but these are what we know. So we started in 2017, so we have 2 full years of data and about another half year for this year. In 2017, we saw 29 homicides of trans people, and 29 of those, 72%, were with a gun. So it's a pretty large chunk, and it's higher than the national average of homicides overall. And we also knew that when these homicides were of trans women of color, that percentage was 81%. The next year, in 2018, the numbers looked similar. 69% of the 26 homicides of trans people were with a gun, and when those victims were women of color, 69%. Again, every single one that was with a gun was a woman of color. 2019, so far this year, there have been 5 homicides of trans people reported. All 5 have been with a gun, and they've been Black women. We also know that the average age is devastatingly low, around 30, but that's right around the national average of homicide victims overall. Next slide. So there's no national database or even local databases on a police agency level that track trans homicides. Death records, FBI data on homicides that come out every year, none of it captures sexual orientation nor gender identity. So a lot of tracking this is pretty nitty-gritty. We literally look for times where the media has reported on these incidents. I have Google alerts and various different ways of scraping news reports, and every time one pops up, we just enter it in our spreadsheet that goes into these statistics. It's not, it's filling these data gaps, and the point of this case study a bit is to show how unglamorous but also manageable it can be to just kind of find what's available. Next slide. And so, of course, the system is not perfect. It's not official data. It's not peer-reviewed. It's a grassroots type of process. We have partnerships with a number of other organizations that are keeping their eye on this work too, and we alert each other when we see one. But it comes with issues. So the reliance on media reports and social media, like I said, make it likely that these are an undercount. We can imagine that there are other trans homicides who weren't as connected in the local trans community that's pushing these incidents up to the local media. We also know that misgendering and dead naming is a huge issue when we're relying on this type of data source. An investigation by ProPublica found that of the 65 different law enforcement agencies that had investigated murders of trans people since 2015, 74 of 85 victims were identified by names or genders that they had abandoned in their daily lives. And so, of course, this is awful and completely unethical, but it also creates an issue when it comes to data gathering, because these incidents often come up as that screenshot you see on the left, just completely misgendered, and the word trans or the actual identity is not in the initial reports, which makes it not come up in our media alerts. And so, again, it's a very grassroots kind of process of alerting each other, and we have a bunch of volunteers around the country that keep their eye out in their local community as well. Next slide. And so a bit of what we do with these numbers, with these data, within our organization, a natural partnership to this work was with our communications team. I'm on the research team, and so we partnered with the communications team and realized quickly that the way to address this hole in the data is to encourage more reporting by the media. And so we pledged to put out a press release for every single gun death of a trans person, and that we usually focus on more policy-based issues in our press releases, but we realized that this is a very tangible way to address this issue. We figured that if we show the media that not only is this an important issue that readers care about, but also that reporting accurately and thoughtfully, to model that accurate and thoughtful kind of reporting. Next slide. Next slide. And so this is how that manifests. We started encouraging our media contacts to start publishing op-eds and larger investigation pieces on the issue, and plugged gun violence in every single one. Next slide really quickly. I'll turn it up. I just wanted to read this one quote from my former colleague, Valerie, who started this passion project with me. She said that when we talk about queer liberation, trans liberation, or Black liberation, gun violence prevention has to be in that equation. Because there are people out who don't think we deserve to live. And so I think that's a really powerful way to show how this intersection of these two issues, the time is now. We need to start getting this data so that we can speak accurately and wholly about the way that gun violence unquestionably impacts trans and LGBTQ people. Next slide. I think it's important to close by taking a moment to remember the humans behind these statistics as well. These are the faces that we do this work for.
But in any case, I recommend checking out the Williams Institute's actual reports, because that way you can have a fuller picture that we weren't able to get to in the deck itself, and it also has the actual citations to the underlying studies. And so the reports themselves are the much better resource than the PowerPoint deck. But with that, we will conclude, and thank you for participating in our webinar. Please check out the Hope and Heal Fund, Every Town for Gun Safety, and of course the Williams Institute, and we thank you for being with us this morning. Thank you.